The next one is focal segmental glomerulosclerosis. This is also the type of nephrotic syndrome, as I told you earlier. So, from the name, the focal mean some glomeruli will be involved. The segmental mean that some segment of that glomeruli will be involved, and actually sclerosis will be occur. Sclerosis of some segment of some glomeruli will be occur in this disease. Actually, this disease is common in a black people like Hispanics and African American. Okay, usually this disease is idiopathic but may be associated with the HIV patient. Heroin use the patient uh, which use heroin, and the patient of sickle cell disease. I will give this a star. This is actually important. Okay, the findings. What will be the finding on light microscope, immune fluorescence, and the electron microscope? So again, I will give this a star. This is very high yield because this will be the point by which we can easily pick the MCQ type of question. So the first one is what will be there in light on light microscope when the patient have a focal segmental glomerulosclerosis. So there will be a segmental sclerosis and a hyalinosis will be there. So remember this point. Uh, the second one is immune fluorescence. Immune fluorescence is negative, but this is important, but may be positive for non-specific focal deposit like IgM, C3 and C1. This is very high yield. I will give this a star. Very high yield. This disease sometimes have a immune fluorescence positive for IgM, C3 and C1. Okay, the third one is electron microscope. What will be there in electron microscope? There will be a fistment of food processes. Okay, the next is note. These focal segmental glomerulosclerosis give a poor response to steroid, and it should be differentiated from minimal change disease. So let's differentiate this. Okay, the first one is minimal change disease and focal segmented glomerulosclerosis. Okay, minimal change disease. These give a good response to the steroid, and these give a poor response. The first one, on light microscope, it look normal and it give this sclerosis. Okay, this is the main differentiation between these two. Actually, the one is that minimal change disease is most common in children's. Okay, actually this is the main differentiation between them. Okay, now look here, let me change the pen. This is the part where sclerosis occur, and this is the part where this one is totally normal. So I will N for normal, S for sclerosis. So this is the focal segmented glomerulosclerosis. So some segment, and this is one glomeruli, some glomeruli will be involved. Okay, now let's go through some MCQs. So okay, uh, this is the 35-year-old male present with the feature of nephrotic syndrome. So they already said that the patient have a nephrotic syndrome. In addition, there is a microscopic hematuria. So now look, actually hematuria is the characteristics of is the property of nephritic syndrome, not a nephrotic syndrome, but there is a microscopic hematuria. Okay, so The renal biopsy showed the partial sclerosis, partial sclerosis affecting some glomeruli. This is pretty easy MCQs, but this is the main point that the sclerosis area show the IgM and C3 on immune fluorescence, which I call you actually immune fluorescence will be negative, but sometime may positive for IgM, um, C3 and C1. So this is important. So the diagnosis is focal segmented glomerulosclerosis. Easy MCQs.